Hello.
Hello.
Hi.
Hello. You have to stand there. Can I give you this microphone? You won't hear yourself speaking. It's to do with filming over.
Fair enough. Good evening. My name is Parveen Verasingam. I'm a laparoscopic fellow, also a PhD researcher in artificial intelligence and virtual reality. So today my pitch is going to be about how do we use virtual reality in maternity services in order to alleviate some of the issues surrounding anxiety among pregnant ladies. So moving on. Now, virtual reality is not a new topic. In the last few years, we've seen an explosion of virtual reality technology, especially in medicine. As you can see from the snippets on the slide, is being used currently as a distraction tool for pain therapy. As you can see from the picture there, pregnant mothers are using it to distract them from pain during labor, and that is in Cardiff, I believe. And more hospitals are using virtual reality as a tool, as a virtual tour, to show patients what facilities they have and what kind of services they offer and so on and so forth. So what do we know so far? We know that about half of patients, before they undergo any operative procedure, they tend to have anxiety. Now, the problem with anxiety is it makes the entire anesthesia process slightly longer. It reduces their satisfaction, and we find out that they require more analgesia as well as soon as they wake up from the general anesthesia. And the kind of research has been shown that VR actually improves their overall experience, and also the analgesia requirement among these patients are also reduced. And also the other important thing that we need to know, that more and more care are being centralized nationally. Now, Royal Cornwall Hospital is a tertiary referral center for gynecology and endometriosis. So we get patients coming in from across the region, coming to this hospital, and these patients are not familiar with the setup of the hospital. So this is where we're going to use our virtual reality technology to show patients in the comfort of their own home that, what kind of services we have, the personnel involved in their care, but in context of maternity. So our vision by using virtual reality is we want to be among the first hospitals in the world to actually bring virtual reality, not just for patient visiting in hospital, using in hospital. We want to bring this technology to their homes as well, so they can view these videos in the comfort of their own home. And the videos that we are going to use will hopefully empower them to make decisions, be part of their care. Now, we do, from the research that has been done, we know that virtual reality videos has got a slight advantage compared to normal 2D, two-dimensional videos in the sense that they're more interactive. So they can basically be transformed or transferred into, for example, an operating theater, and have a look around so that they can familiarize themselves with, for example, if a pregnant lady has chosen to have an elective cesarean section, and they're not entirely sure what to expect, then they can transform themselves into the theater to have a look around, just to familiarize themselves with their surrounding. So this is an example of a virtual reality video that, sorry. Yes, please. Yeah. So as you can see, if they were to wear the virtual reality headset, they are immediately transferred into the theater setting. And you can see the little blue dots. If they want more information regarding personnel or the equipment, they can just point their clicker onto the blue dot. So we are asking for $2.5 grand. What are we going to use the money for? Is basically to purchase 3 of these virtual reality headset. Now, we're going to place this in the hospital because we realize that not all patients would have smartphones. The whole idea is to bring this technology to homes. But then again, at the same time, we want to include all patients. So it's unfair to assume that all patients have smartphones. So hence why we would like to purchase 3 headsets, and £500 we would like to allocate to purchase cardboard headsets, so patients can use the cardboard, take them home with them, and then they can use their smartphone and visualize their virtual reality footages at home in their own comfort. And yes, we have the technology and the expertise to edit and produce the videos ourselves, but we think it would be better if we outsource it to postgraduate students from University of Plymouth. So in essence, so that it looks better, more professional, and also what we're trying to do is trying to promote local talent in virtual reality. I think that's all.
Thank you very much indeed. Thank you so much, Parveen. Thank you. Adam, Kim, questions?
So to go back into your presentation, was it just those 3 groups you were looking at? So it's endometriosis, oncology.
No, I think what we're going to focus on first before we extend it to other groups is maternity services.
Okay.
We know that in oncology, I've done the research in oncology, and hence the data is used. I'm using the data to show that it's actually beneficial across all groups. But what we want to do is we want to concentrate on maternity on 2 aspects: the virtual tour, showing patients what the labor ward is, what anesthesia they can have in terms of epidural, gas and so on and so forth, the theatre environment, pool birth. That's one aspect, the tour group. And the second aspect, what we are quite passionate about, is to produce a virtual reality video of breastfeeding. So a lot of women, when they're in hospital, they tend to get very good care in terms of one-to-one advice on breastfeeding. But when they go home, sometimes they need a bit more support, and this is where I think our videos will come very helpful. If we produce a virtual reality video of breastfeeding, troubleshooting, and so on and so forth, they can view these videos in the comfort of their own home.
Oh, that's brilliant.
So those are the 2 areas that we want to concentrate on.
Great, thank you.
Has your research shown you so far the kind of on costs or maintenance issues or that sort of thing of this kit? So,
Yes.
so what I'm interested to get to is, so there's a 2.5k initial investment.
Yes.
How long would you expect this kit to last for, and what sort of on costs might
That's
there
a very
be?
good question. Now, based on my research, one of the things I was looking for is how are we going to sustain this for a long
Sure.
time? And most of the videos, most of the technology that's available out there, yes, there is a cost associated with it, but there are ways where we can, for example, the videos that we use, we need to rent a server, we need to host it somewhere so that patient can access. But we found a way around it. There is an open source project. It's free. So from a hosting the video point of view, it's free. The initial cost of producing the video, there might be some cost associated with it in terms of filming the video. But in terms of editing the videos, producing the videos, everything is done in-house. So there is no cost associated with it. And in terms of how long does the product last, the Oculus Go headset comes with a 2-year warranty, and it should last a long, long time. And the other thing is, if we're going to use this in hospital, one of the other questions that I get often asked is hygiene.
Yes.
You can't use the same headset for everybody.
Yep.
But then there are face plates, for example, just like a removable face plates where you just attach on the headset. So as soon as the patient finishes uses, you can remove it and throw it in the bin.
Yep.
And that is roughly about 4p per face plate.
Sure.
So it's almost negligible. But we hope that in the future, as time goes by, the technology will become cheaper and cheaper. And obviously, one of our visions is to be one of the first hospitals in the world to actually introduce this to the masses. And we hope that by doing that, by being the pioneers in it, then it will raise our profile, and somehow companies would be interested in supplying us the products, and that would pretty much offlay the cost of the technology itself.
Fantastic, thank you. Was there anything you wanted to ask, Adam?
I think it's great. We've had 4 pitches now around
On
either
VR.
or something similar,
Yeah.
and I've got no doubt that it's got a really bright future. It's happening now, isn't it?
Yes, it
the
is.
quality of the headset's going to improve.
Mm.
The price is going to come down.
That's very true. On top of this as well, it's like, I know the previous speeches, there was some VR products that have been discussed on the den. With the expertise that we've got, we can always cross specialties and see how else we can work with pediatrics. We know that for a fact there are a lot of investments been done in VR in children, in pediatric care for autism, anxiety, and so on and so forth. And a lot of research has been done in the Great Ormond Street Hospital. The technology is there, the expertise is there. Just a bit of nudge in terms of funding, and I think it will take us further from a VR point of view.
Thank you. So we have decisions to make, but I think in general for me the message that goes back is to talk to Kelvin as our Director of IT, of Technology, because exactly as Adam said, you're the 4th really compelling pitch to talk about the use of VR. So I think we ought to be looking at it across the trust. So for the time being, thank you very much
No
indeed.
problem. Thank you.
Well done. Thank you very much. Back from the doors. Thank you very much.
Okay, so how was it pitching to the dragons in there?
I thought it was, first and foremost, I thought it was a brilliant idea. It's we've got quite finite amount of resources. It's trying to figure out which specialty or which group needs the funding the most. And by doing this, then you can actually, each unit will need to pitch their ideas and find out, and the Dan will pretty much be very objective about which idea is the best and provide them with the funding that they need. I think it's a brilliant idea.
And how were the dragons?
I think they were really nice and pleasant, so can't complain.
Brilliant.
Yes.
Well, good luck. Fingers
Well,
crossed
thank you.
for you.
Thank you.
Thank you.